Hi everyone, I'm Dr. Erick Mendoza, an endocrinologist. Got any question about diabetes management? Worry no more. Let me spill the tea in 10 minutes. Do you know that only 2 out of 10 Filipinos are achieving HbA1c target of less than 7%? Only 3 out of 10 patients with HbA1c more than 7.5 will receive treatment intensification. The median time for physicians to actually intensify treatment is 2 years. We pulled some of the most frequently asked questions by physicians, and we are here to answer them. Let's try to answer the first question. What are your recommendations to overcome clinical inertia in diabetes management using practical real-world evidences? Clinical inertia can be overcome by 3 simple ways using the Mnemonics App. First, address. Address patients' misconception about diabetes and treatment. Next, challenge. Challenge the patient's capacity to make changes for his or her improvement. Finally, trust. Trust in the patient's ability to overcome fear and failures in diabetes management. The physician must be able to address misconceptions and myths about diabetes and its treatment. Common fake news that patients subscribe to are the following. Multiple medications, including insulin, can worsen diabetes. Anti-diabetic medications can damage organs such as kidneys and the liver. Herbal medicines are better substitute as they are more safe and effective. Now, how do we address these false claims? Remind the patient that the natural history of diabetes is progressive if left untreated or undertreated. Controlling glucose before beta cells start to fail can make a lot of difference in preventing complications. Emphasize that diabetic kidney disease and non-alcoholic fatty liver are due to poor glycemic control and not drug-induced. Debunk unproven claims about herbal medicines such as insulin plant and spirulina, for example, for diabetes treatment. Do not criticize the choice of the patient. Rather, we should convince them to abandon non-evidence-based therapy. It is important that we challenge our patients to become better versions of themselves and give them realistic goals. Finally, trust in your patient's capacity to change. Give them a pat in the back for any improvement, no matter how small it is in the beginning. Words of encouragement from us physicians mean a lot to them. Let's try to answer the next question. Can you comment on the use of incretin-based therapy like DPP-4 inhibitors with regards to its role in postprandial control of blood sugar with low risk of hypoglycemia in early combination treatment? Let's try to answer this question. Incretin-based therapy has transformed the way we manage type 2 diabetes in nearly 2 decades. Since sitagliptin was approved in 2006, followed by the other DPP-4 inhibitors, physicians were able to fine-tune glycemic control better, minus the higher risk of hypoglycemia from earlier anti-diabetic agents. Several studies have shown that postprandial hyperglycemia is strongly correlated with cardiovascular complications more than fasting hyperglycemia. Unfortunately, postprandial hyperglycemia is more difficult to detect and manage because these are glycemic excursions after meals, for which most patients are unaware of. Incretin-based treatments reduce post-meal blood sugar because of its stimulatory effect on insulin and inhibitory effect on glucagon secretion. But the very simple reason for postprandial glycemic control with negligible risk of hypoglycemia is because DPP-4 inhibitor acts in a glucose-dependent manner. The higher the glucose after meals, the greater the capacity of incretins to increase insulin secretion. On the other hand, it does not promote insulin secretion when glucose concentration is below 90 mg per deciliter. patients near HbA1c target often have optimal fasting blood glucose level, but the postprandial glucose elevations is the one that is problematic. Using more potent drugs such as insulin or sulfonylurea can achieve further glucose reduction at the expense of unwanted hypoglycemia. DPP-4 inhibitors can lower HbA1c by an average of 0.6%, the little push that most of these patients would rather need. So that's it for today. See you again on the next episode of Spill the Tea with Dr. Erick Mendoza.